Hi, my name is Kiran Bains. I'm a health psychologist and I'm also the co-lead for the Division of Health Psychology, Equality, Diversity and Inclusion Task Force. And this is part of a series of podcasts on how we can bring that into the field, into practice for people who are interested in the field and currently working in it. And I'm joined here today by Shadia Edwards-Dashti, who I will allow to introduce herself and what she does, and we'll bring it together.
Hi, Kiran. Thanks
Hi.
so much for having me today. Yeah, my name is Shadia Edwards-Dashti. I am a journalist, but mostly I am an activist. Right now, I'm working. A majority of the work I'm doing is within the community. So I've just been elected as the community officer of my local football team in West London. So what that means is I put into practice loads of different campaigns and strategies to really help out in the community. Basically, I do what it says on the tin, try to help out as much as possible to reach the grassroots community in the local area.
Sounds really exciting. And I suppose I'm really interested in the kind of work that you've been doing from a community football and reaching out to marginalized communities perspective and how that relates to health psychology. So I'm really excited to hear a bit more about what you've been doing so far in the club, if you'd like to talk about that. So
yeah, absolutely, sure.
Yeah.
So this position as community officer, it wasn't really a position before last season. So what I did is try to engage in the politics of the time and what was relevant at the time. So last year, particularly last season, we saw the fall of Kabul to the Taliban with the withdrawal of Western allies out of Afghanistan. Of course, that saw a huge influx of refugees, not just in Europe, but of course coming right here to the United Kingdom. We saw thousands and thousands. Which is great that the UK, in some senses, it could do a hell of a lot more, of course, opened the borders to allow refugees to come. But what happens next? And so particularly in the West London community, we saw that there was a space where majority of the time, people that give donations, it's to men, it's not to women. A lot of the clothes are tailored for men. And actually, there were a lot of women coming from Afghanistan to West London. So that's really where my community work stemmed from, seeing that there was a gap really for this marginalized community. And there was a space where my football team could fill, quite simple, really, going through your wardrobe and finding clothes that you don't need. And with a football club of a squad of 100, that equates to quite a lot of clothes. So that was really great that we were able to communicate with the football team and get a huge amount of donations. It was really, really wonderful to see. So that was basically the first thing that we did at the football team, to engage in the community on that level. And that really was the launch pad to many other things that we organized throughout the season.
That sounds really, really interesting, and it kind of touches upon how different forms of inequality can intersect there. Having clothes that are tailored for men, that means inevitably you miss other things such as menstrual products, and we still have the gender division of labor when it comes to childcare for children's clothes and those kind of things, which women tend to take more responsibility from. So I can imagine that maybe came into your initial strategy, and it sounds really, really practical and direct in the way that you engage with people.
Yeah, it's really interesting that you mentioned menstrual products, for instance. That was something that I also asked of the football club to just add on to their shopping bill, a pack of tampons or sanitary products, because it might not add up to much on our shopping bill, but it goes such a long way. Period poverty is such a huge thing. Never mind for the refugee asylum seeker community. It's a big thing regardless. Just a few weeks ago, we saw Scotland become the first country in the world to essentially end period poverty by making all period items free. And that's a great step to take, and something that here in England we should use that model. And so I think there's a long way to go, particularly with menstrual products that you mentioned, and that is also something that we tried to provide for women, particularly from the asylum seeking backgrounds too.
Absolutely. And from a health psychology perspective, I'd be really curious as to that policy in Scotland and what impact it has on other health outcomes for, women and girls and, gender diverse people in Scotland, for accessing, education, for health literacy. I'd be really curious about that. Just a reflection that I'd like to add. So you talked about it being a launch pad for other activities. Can you tell me a bit more about what followed from that?
Yeah, so, unfortunately then we saw Ukraine invaded by Russia. And again, that provided another opportunity to reach out again to the football team and ask again for donations. This time, not clothes, but more, as again, menstrual products, but also other items for sanitary use and more youthful, tailored products rather than just clothes, because I think that the Ukrainian refugees had a lot of donations at the time. But again, it was a reaction to what we were seeing in the global current climate, and we were reacting to something by trying to do something positive for the community. So again, that was a donation-based event that we tried to help, and there are many different centres around West London where you can drop off donations, and then they will then take them on further to those that need them, those most vulnerable. So that again was another donation scheme. But what followed then was later on in the season, in April. April was the month of Ramadan, but also it coincided with the Football Welcomes Refugee Month, which is a nationwide campaign where various big football clubs get involved in to try and welcome refugees and asylum seekers into their communities, but also onto the football pitches. So it's a really nice way of organizing people that need an outlet, really, and providing them with that space and that outlet by organizing and hosting football tournaments. So I mentioned it being the month of Ramadan, and particularly for the Muslim community, that's really important. And majority of asylum seekers here in West London are from the Muslim community. So it was a nice way to incorporate both their religion and their passion for football in the same way by hosting a football tournament followed by an iftar event. For those that don't know what iftar is, it's the time where Muslims break their fast in the evening. So we managed to amalgamate the two into one beautiful event.
That sounds wonderful. I bet it took a lot of organizing. What kind of things helped you to organize that in practice?
So the event really was one that you couldn't really anticipate what the reaction or the turnout was going to be. Of course, asylum seekers and refugees don't really have the means to sign up even. They have so many logistical challenges. So we really didn't know how many people we were going to get. But on the day, 60 asylum seekers turned up from West London, which is just an astronomical number, really. People from all over the world. It was so diverse, so beautiful. We had people from the Sudan to Afghanistan, Libya. We even had a couple from Ukraine, Eritrea, all over the world. We had people. It was so, so wonderful to see. And they were all just there to play football and just to take their mind off things just for a short amount of time. Everything was provided for them. As I mentioned, it was Ramadan at the time. All food was provided for them. So it was such a great event that my football team could host. And it did take quite a lot of work to do. As I say, you can't really anticipate how many people are going to turn up, but it was so successful, and it's something we really want to try and do again.
Sounds really exciting. Is there anything that you found looking back strategically that helped get such a high turnout, that helped make that happen?
I think one of the things that made it so successful is really passion, and that is something that comes through for anybody that's a campaigner or activist or involved in any sort of charity or goodwill gesture. They all come from the idea of passion and this unity of wanting to help. So there were many logistical challenges, from financial all the way to travel issues for asylum seekers to get to the place. We overcame the financial hurdle simply by fundraising. We overcame the travel issue by a few of us escorting asylum seekers to the football pitch. But all of it really comes from a place of passion and wanting to help out. I particularly have a really strong desire to try and help the refugee asylum seeker background. I really, really do. And I think that everybody involved on the day also shares that too. Of course, we're all one disaster away from being in a position like they are. And I think that level of empathy came through from all of the volunteers on the day that were there.
Absolutely. And it sounds like you really worked as a team. And what I'm also hearing underneath that is that you have a really good knowledge of, the kind of things that, the population that you're working with in West London. So you really know your local community and where to go and, to engage people. And that you worked really well together with other people as a team. Was it just the football club that was involved, or were there other people involved in helping to coordinate that?
So we actually branched out to other organizations in West London, other big human rights charities in the local community. And so that's when you see a collaboration of various different bodies all coming together to try and help out. And that's what made it really successful. It's a coalition of an effort in that sense. So it wasn't just our football team, but we reached out to other organizations who, again, were absolutely vital on the day too.
Yeah, that sounds like it's really important to kind of work with what's out there. And I definitely agree from my work in my practice, connecting with organizations that you want to work with is really important, and building relationships with those organizations can also really help to be able to coordinate that around what you had, which was a really specific sort of thing that event that you had in mind. And the other thing that kind of occurs to me is that you're kind of using that event as a springboard for further collaboration. And I encourage other people and in research and practice to look at these kind of, if you like, these triggers and these potential events to come around, even if it's a launch event for something that's like a bigger project, to then facilitate further work together. I also find it really interesting, from a health psychology perspective, having a football tournament. Is that you said that was, and then having a meal together. It sounds really simple, but given some of the difficult things that people have experienced, my understanding is that they can be really traumatic, and that can put your body in high alert, in constant high alert, to kind of prolonged fight or flight reaction. I don't know if you know that term, when you're fighting off a stressor, and that that can over time be quite detrimental to your stress response. Your hormonal response to stressors gets blunted, and sometimes having that that safety, having doing physical activity, physically working out the stress and having connection can help your body to recognize when you're at rest and respond more dynamically to threat, rather than being in threat mode all the time. So we look at that in relation to something called heart rate variability. So if your heart rate is not very variable, very static and constantly high, that might indicate that you're in threat mode. Whereas if it drops and it's lower in a resting state, that may actually indicate that you're responding more dynamically to the situation that you're in, the environment that you're in. So it really excites me to hear about this, because I think we underestimate how important these things are for us as human beings to be able to cope with difficult situations.
Absolutely. I think a lot of these people, majority of these people that came to the football tournament, they've been through some really, really difficult times, not just traveling here to the United Kingdom under very scary and dangerous circumstances, but also leaving the home that they were living in back in their respective countries that are arguably very traumatic and stressful conditions as well. So that dual concept of stress, plus on top of getting here and being still in a very stressful environment, considering this temporary accommodation, they don't have settled status. If you don't have settled status, you don't have the ability to work, and therefore you cycle of trauma essentially. And so something like playing football, for anybody that does play a sport, not just football, knows that it does have the power to not only unite communities and different peoples, but also on an internal level, it acts, as you say, as a huge stress reliever and escape. So I think that there were so many mental health benefits from what we were doing on that day.
Absolutely.
And too, because they're not in a position where they have much access to football equipment, for even football boots or t-shirts, kit. So to be able to provide all of that, I think that there were huge benefits for mental health, but also physical health.
Oh yeah, and opportunities potentially for the future. I mean, again, for putting my research hat on, I'd love to see, what the impact on stress is of being able to do those things over time. I do think that sometimes, for those of us, a lot of health psychologists either work in universities or in hospitals. Not so many actually are based in community settings. I might get a few angry emails saying otherwise, but there's these kind of opportunities to reach out to people through things like football, could actually be a really good way and other sports, as you say. The kind of things that you're doing could actually be a real opportunity to engage with people around their health in a way that's, hopefully A, more accessible, and B, potentially less intimidating or less, clinical. And I'd love to see that, the impact of that, and where we could maybe add some of these, our like perspective and our skills, applying for funding and doing the research and building, if you like, the case for having more of these initiatives. I think we could potentially be quite helpful, even though those things can take time. So yeah, that kind of does occur to me as well.
I just say one thing to
Yeah.
jump there as well. Another big thing is the language barrier here as well. And it's good to have non-verbal activities like something like football, which isn't based on a level of communication, because what you find is when you have people coming from other countries without the ability to speak in the language of that country, you kind of lose your identity. You lose who you are. You don't know how to communicate. You might be quite a funny person back in Afghanistan, but if you're here in the UK, how are you supposed to convey that you're this funny person if you can't speak the language? And therefore you'll see a lot of asylum seekers retreating into themselves from an identity perspective, not just in terms of the trauma they've gone through, but how they're really struggling to get their identity out at the same time. So something that isn't verbal, in a sense, can be really powerful as well.
Yeah, absolutely. And isolation also has a real detrimental effect on people's physical health. There's, over time. So that also is really important, to have that social connection, and, and for it not to be all based around words. I think there's also something about, particularly, where we work here, we do rely a lot on language and talking. I work as an applied psychologist in a hospital, as doing work as a therapist, talking therapist, so I'm aware that that is a lot of my job. But thinking also about connecting with people, sometimes actually doing something nonverbal, as you say, can be that much more powerful, and in a way that is different from, say, talking therapies, and which can be difficult for people with insecure status to access anyway. So yeah, no, that's really important. So with that, I think we've had a bit of a pre-chat. You've talked a bit about you've talked about that tournament, but you told me a bit about a follow-on event from that. Could you tell us more for the benefit of the audience?
So we also, within the same month of this Football Welcomes Refugees, we also held a separate event for young kids from Afghan backgrounds, which was so good. Again, had no expectations, didn't really know what we would be able to achieve, but we collaborated with another football team that is based near Heathrow Airport, where lots of this recent influx of Afghan people have come, and they're staying in that local area. And a lot of these girls, again, haven't ever had an opportunity really to play football, but we managed to host a football tournament for these young Afghan girls between the ages of 5 and 12, really. There's lots of mixed ages. And we were able to bring girls from our West London football team so that they could all play together. The idea there was totally inclusion, and we called it a football festival. It was so brilliant to see all of these kids really mixing and being so inclusive, so welcoming. They just wanted to make friends. It was very much about friendship, not just football. And that one, because we learned from the previous event, we were able to take it a step further. We again fundraised, we got kit, but we also provided things like educational resources, which is something that some people may not necessarily think of, but a book can go such a long way to somebody just come to the United Kingdom, and it's so easy to do that. We got lots of donations from other kids in the community, and then they physically handed the books to the girls themselves, and that was so beautiful.
It sounds like an amazing thing, and so many benefits of education for women and girls. And there's I'm aware that if for refugees and asylum seekers, getting access to education is so difficult for a lot of people. Sometimes people can miss that for years. And for women and girls in particular, there's so many barriers sometimes, linked to a bit of what we were talking about with ideas around menstruation as well, and period poverty. But certainly it's a meaningful act to give them the means to really bridge that gap and bridge the language gap, as well, that they might experience from having to move here to restart their lives. It sounds really important. So I mean, with the outreach for like the girls, and you talked earlier about reaching out to women and girls in particular, so is that kind of a strand that you would like to take forward, thinking about the kind of things that you do in the future?
Certainly, going forward into the next season, I think as a women's football club, it's really stick with women and girls and anybody that identifies as such as well, to target them in terms of how we can help best in the community. That would be ideal. I think the idea of period poverty, I know we touched on it, is super important, as you mentioned, because of the mental health aligned with it, but also physical as well. I think it's such an important issue. So that's something that I would quite like to explore. But in the local community, there's a lot that the club can get involved in. Homelessness, of course, to food banks. Food banks are really in need of volunteers at the moment. We're in the middle of a cost of living crisis, which is only going to get worse as we hurtle towards the winter months. It gets cold, energy prices are going up. things are looking really quite challenging for the local community, not just women and girls. So I think there is a big scope that we can try and help out as best as we possibly can. As I say, the cost of living crisis being a huge motivating factor there.
Yeah, and I think that's the thing, isn't it? And I think, you know, in our profession as well, we do kind of sometimes have to react to what's happening out there. You know, one of the things that we got involved with, for example, start of the pandemic, was, you know, doing a lot of, you know, brought together a bunch of health psychologists to advise on different things around different areas of concern around COVID and the use of behavioral science. We had something called the Health Psychology Exchange set up, so where people got together in groups to advise on, you know, different topics and bring together research around that to advise different community organizations. And I do think that perhaps something that we might, you know, think about, okay, these are some of the challenges that people face. How do we, you know, because again, it's about mass collaboration, and, you know, we can do that between ourselves, but actually connecting up with community groups and like the football club might actually make quite a big difference in terms of what we're able to achieve, also from a public health perspective. You know, there are times when we ourselves might struggle to reach out to marginalized communities, and actually working with community clubs who are already doing it might mean that we reach other people otherwise wouldn't. But I wonder if you know, hearing that, you know, about the potential for an academic or a public health person, or, you know, an applied psychologist a health psychologist wanting to work with you to reach out to marginalized communities, is there anything that you'd like them to bear in mind about doing that effectively and thoughtfully?
Well, I think it's very much about tapping into how far the community is really willing to go, and that it is a baby step situation. I think that's really, really important to know, that sometimes the community just don't feel up to it on that occasion, and that's okay, because we are dealing with people that have trauma in various capacities, and that can be quite stifling and paralyzing. But also don't be demoralized by that either. It doesn't mean that it's a never situation. It is difficult to tap into that particular community, but I really would advise, you know, baby steps, and to take your time.
Absolutely. Trust is something that is so important, and I get to hearing that between lines, and certainly into my own work, building relationships and trust took me, you know, a bit of time to really understand the people I was working with. I was working with people with learning disabilities at the time, actually, and it took me a little while of understanding the people I was working with in order to do the work that I was doing. But it really paid off. And I think, you know, when you are working with marginalized communities, refugees and asylum seekers who might, you know, they may be afraid to engage with services. They may be afraid of what it might mean for their, you know, their settled status, for example. You know, then it becomes really important, as you say, to take the baby steps and meet people where they are, which is what I'm kind of getting through. Yeah. Okay.
Yeah, absolutely.
Yeah. So sometimes, and I, you know, I think I completely agree with this from my perspective. You know, we need to let go of our agenda a little bit, you know, and just think about, okay, how can we use our knowledge and skills to help out? You know, is this, you know, where might we need to be a bit more flexible with how we approach things? That's really helpful. I guess the other thing is that, and I'd love to have your perspective on this, is, you know, one of the concerns I have sometimes is that with research projects and things like that, you know, it can take time to get funding and those kind of things set up, and they can be a bit rigid, and they can also be a bit time limited. So do you have any, like, from your perspective, do you have any thoughts about that, you know, in terms of, you know, considerations for working with psychologists on that? You know, this is just an open question.
Yeah, so I mean, in terms of getting funds and grants, it's super challenging, isn't it? I think
Yeah.
a project, it is a difficult, laborious, and sometimes bureaucratic process.
Mm,
But what I would say is that fundraising has been a dream. In my perspective, it has been
mm,
a really good way of getting the means that you need,
mm,
and quite quickly, because unfortunately you have to rely on fundraising if you do not get a grant or the funding
mm,
from other places. But you're being so direct with the local community. You're
mm,
explaining exactly where this money is going and how it's going to be spent. And majority of the time, if people have the money to spare, they
mm,
will spare it for a good cause. And
mm,
to then have those donations coming from people in your direct community, you can show them exactly what you have then done with that
mm,
money. And from a psychological point of view, for them, they feel like they're part of the solution. So,
mm,
in some senses, fundraising is an even better way to get
mm.
money, because people then feel part of the solution. And
Yeah.
when you feel part of a solution, you feel part of a community. And at the
Mm,
end of the day, what we're trying to do is create that sense of community, and to have this whole hybrid system where everybody is involved in helping.
yeah, that's a really good point. I'm guessing what you're talking about there is like crowdfunding
Yeah.
initiatives. Yeah, 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 yeah. No, that's a really good point. And certainly, for I mean, navigating the grant system, as you know, as you may be aware, it's difficult. And it might be, even if for those people who have to do it for their research roles, it might be that fundraising can help with getting a pilot together to get some evidence together for a bigger grant. And as you say, it takes a lot of people coming together to make meaningful things happen.
Mm, mm,
And the other thing I think it can be quite helpful, which with yeah, and this is just my perspective, I guess, from my experience. It can also help if we just do things that are evaluations to see what is working and what isn't, and then even with that, even if we can't always do a full-on research study, those kind of things can be quite helpful ways to reach out to the community. I know that sometimes universities actually do have funding pots for these kind of community engagement type activities. So rather than kind of if spending time, lots of time figuring out what the remit of that is,
mm.
actually working with community groups and organizations who are doing it, and they're offering support and skills to evaluate and help feed that learning forward, and input into the kind of work that they do for can really help their work. And and I think we underestimate the power of that.
Yeah.
you know I don't know if that resonates with you, just having that from someone who's coming from an academic perspective, for example. you know
Yeah,
yeah.
exactly. I completely agree with you. I think there's so much that needs to be thought of,
mm,
um, particularly amalgamating all of people's different skill sets as well.
mm.
Is that what you were meaning?
Yeah, yeah. I think thinking, because with thinking about the audience, part of the audience here is people in health psychology, and thinking about what we are likely to be able to bring to the table. Some of those things are to do with evaluation skills, research skills, report writing skills.
Mm,
And those are kind of things that can really sort of bolster the case for future initiatives that can really mean a lot to people. Yeah.
definitely, and again, it goes back to community, how with different
Mm,
people bring different skills to the
mm,
table, then skills that are transferable. These
mm,
are all really important, and that's why it's good to get like a core team together when you're working
absolutely.
of project, because the more people you have on board and the more skill set you can bring to the table, um,
Mm,
as you say, from an academic perspective, writing skills to artistic skills to health skills,
mm,
different things to think about.
absolutely. Yeah. And I think also, I mean, I think it'd be remiss if I didn't mention it. We also have certain models around in health psychology. We have these models around behavior change, and implementing change. And one of the more popular ones is called the capability, opportunity, motivation, and how that translates to behavior change, that model. I think those kind of things can be, a useful framework, I suppose, to think about in terms of there's something called intervention mapping. So you have a community come to the table, if you like, representatives kind of agree these are some of the goals that we would have, to reach out to these marginalized communities. This is what we would like to achieve. These are some barriers that we identify, and these are some of the things that enablers that, so, could you use your expertise to maybe help us to formulate an evidence-based intervention? And that kind of, co-production can be quite, effective, and I just wonder if, we as as a profession sometimes miss that, because we're not going directly to, community groups who are able to reach, marginalized people in a way that perhaps, particularly academics and institutions and hospitals and, are maybe not so well equipped to reach from our position. So yeah, just a thought. Yeah, absolutely. Having that, that mutual relationship, really. Yeah, definitely. Okay, well, that's kind of it from me in terms of, questions, and it sounds really exciting about what you've done. And sounds like you've put a lot into it. I can hear your passion for it, and but is there anything else that you wanted to add, or anything that we haven't covered that you would like to cover?
I think we've covered pretty much everything, but I just wanted to finally add, that it is really important to know that when you're engaging in anything at a community level, be it charity, campaigning, anything, it starts at your doorstep, and any little help you can give is a great help to give. There is nothing that is too small that you can contribute to any sort of project. Sometimes it can feel a bit overwhelming or a bit unrealistic, but if you just think about doing something small in the here and now, it can go a really long way. So I hope anybody listening doesn't feel like they have to do something on a huge scale, because you can always get involved in something and give whatever you can.
Oh, absolutely. That sounds really good. I mean, you can take my job if you want, because that was a great way to encourage change. But no, exactly. I think sometimes people feel like they need to take on every thing, and when it comes to equality, diversity, inclusion, consider the needs of everyone and how you do that. But that doesn't necessarily, that can be too big to think about. Sometimes having a focused approach of, and thinking about what who you are working with on your local community and the needs of that, and understanding that, and people who work in those areas, can be really, really helpful. So that it just brings it, makes it more experiential, concrete, and that's sometimes a really good place to learn, to start to think about EDI and how you bring it into the work that you do. So yeah, no, I think that's really, really great. I like that you've mentioned that. And I don't think there's anything else that I can add to it. I'm sure I'll think of something later, but but thank you so much for your time, and thank you so much for speaking to me about what you've done. And if is there any way that we could maybe find out potentially more about what happens? Would there likely be any articles that you've got going or anything like that?
Yeah, if you just sort of search Football Welcomes Month, you can find out more. If you put Acton in there, that goes directly to the West London community that we're involved in. So yeah, you can check it there, which would be great.
Yeah, I'll post some links to follow. And I think that's the other thing, is that a good thing about focusing on your local community. It might take a little bit of digging to find out about what's going on in your local community. But if you as a health psychologist or someone in the field, you start with, something that, is close to home, and you have a look around you will find out about what people are doing, because a lot of this stuff goes under the radar, doesn't it, otherwise?
Exactly.
Yeah. Okay. All right. Well, thank you very much. I'll
For
end
having
the
me.
session there. Yeah. And we'll catch you next time.